Have you ever noticed memory slipping away, confusion becoming more frequent, or daily tasks suddenly feeling harder than before? Many seniors fear dementia, and rightly so. It robs us of our independence, our precious memories, and even our personality. But here's the shocking truth: in many cases, dementia-like symptoms aren't only caused by age or disease, they can be triggered or made worse by something as common as the pills we take every day. Yes, medications, ordinary, popular drugs that doctors prescribe for sleep, pain, allergies, or even heart problems, can sometimes silently steal brain function, causing memory loss, confusion, and rapid mental decline. And most people don't even realize it until it's too late. When we think of dementia, we often picture Alzheimer's disease, aging, or genetic risk. But many seniors don't realize that medications can act like brain blockers. Certain drugs interfere with brain chemicals like acetylcholine, which is critical for memory and learning. When acetylcholine is reduced, thinking slows down, confusion rises, and dementia-like symptoms can appear. The scariest part is that these symptoms can look just like permanent dementia, but in some cases, they're actually drug-induced and reversible once the medication is changed or stopped. Do you take pills to help with sleep or anxiety? Drugs like diazepam, lorazepam, or alprazolam are very common. They calm the brain by slowing its activity, which is why they help with insomnia or stress. But studies show long-term use of these drugs increases the risk of dementia by up to 50%. They don't just slow the brain at night, they interfere with memory processing, learning, and concentration during the day. Over time, seniors who rely on them can develop confusion, poor attention, and even accidents from drowsiness. Safer alternatives include cognitive behavioral therapy for sleep, relaxation techniques, and in some cases, melatonin under a doctor's guidance. Have you taken diphenhydramine, chlorpheniramine, or certain cough and cold medicines? These belong to a class called anticholinergics. They dry up mucus and ease allergies, but they also block acetylcholine, the brain's memory chemical. For seniors, this can be disastrous. Long-term use has been linked to confusion, delirium, and dementia-like decline. Even over-the-counter versions, which people assume are safe, can be harmful if taken daily. Instead, non-sedating allergy medicines like loratadine may be safer. Opioids like morphine, codeine, oxycodone, or hydrocodone are often prescribed for chronic pain. But they don't just dull pain, they also dull the brain. These drugs reduce attention, slow reaction time, and damage long-term memory if used for extended periods. Worse, they increase the risk of falls, fractures, and confusion in older adults, sometimes mimicking rapid dementia. Safer approaches include physical therapy, mild anti-inflammatory medications, and natural pain management strategies like gentle stretching, yoga, or heat therapy. Not all antidepressants are harmful, but older types like tricyclic antidepressants, such as amitriptyline or imipramine, interfere with memory and increase dementia risk. Newer antidepressants may be safer, but seniors should still review their medications carefully with their doctor to see if their prescription is really the best choice. Bladder control drugs like oxybutynin or tolterodine are commonly given for urinary incontinence. They work by calming bladder spasms, but they also calm the brain, because they block acetylcholine. Seniors on these drugs often notice brain fog, memory problems, or slower thinking, especially if combined with other risky medications. Alternatives include bladder training exercises, pelvic floor therapy, or newer non-anticholinergic drugs. Proton pump inhibitors like omeprazole or esomeprazole are used for heartburn and acid reflux. They control stomach acid, but long-term use is linked to vitamin B12 deficiency. Vitamin B12 is essential for brain health. Low B12 causes memory loss, confusion, and even nerve damage. Many seniors take these drugs for years without knowing the hidden danger. Safer steps include using the lowest effective dose, making lifestyle changes such as avoiding late-night heavy meals, and checking vitamin B12 levels regularly. Antipsychotic drugs are sometimes prescribed for severe mood or behavior problems, but in seniors, they can speed up cognitive decline. Drugs like risperidone or olanzapine increase sedation and confusion, and are linked to higher dementia progression and even increased mortality in older adults. Doctors now warn against unnecessary use of these drugs in elderly patients. Statins, the drugs prescribed to lower cholesterol, are controversial. They protect the heart, but some studies suggest they may affect memory in sensitive individuals. While the evidence is mixed, many seniors report brain fog after starting statins. If this happens, talking to a doctor can help. Sometimes switching to a different statin or lowering the dose improves mental clarity. Drugs for seizures, nerve pain, or mood stabilization, like phenytoin, valproate, or carbamazepine, can also slow brain processing. Seniors may notice difficulty focusing, memory lapses, or confusion. If these symptoms appear, dosage adjustment or safer alternatives may help. Now you see, dementia isn't always about age or genetics. Sometimes, it's hidden in the pills we take every day. And the most painful truth? Many seniors suffer in silence, never realizing that their confusion or memory loss might not be permanent dementia, but a side effect of their medication. So here's my heartfelt advice: don't stop your medications on your own, but do talk to your doctor. Ask if any of your prescriptions could be harming your brain, and whether safer alternatives exist. One conversation with your doctor could save your memory, your independence, and your golden years. Your health is your power. Protect your mind, protect your future, and never be afraid to ask questions about the pills you take. If you found this video helpful, please share it with your friends and loved ones. Together, we can spread awareness and protect millions of seniors from unnecessary memory loss. Stay strong, stay informed, and stay healthy. Imagine an elderly man named Mr. Ahmed, 72 years old, who had been taking sleeping pills for nearly 10 years. He started noticing that he was forgetting names, misplacing keys, and even repeating the same questions to his family without realizing it. His children thought he was developing dementia, but when his doctor reviewed his medication list, they discovered his symptoms were mostly due to long-term benzodiazepine use. After his doctor slowly reduced and changed his medicine, his memory improved, and he was able to live with much more clarity. This is a powerful reminder that sometimes what looks like permanent dementia may actually be reversible. Another example is Mrs. Fatima, a 68-year-old grandmother who had terrible seasonal allergies. To get relief, she took over-the-counter antihistamines every night. Over time, she became forgetful and confused, often losing track of conversations and struggling to recall simple words. Her family thought age was catching up with her, but the culprit was the antihistamines blocking her brain's acetylcholine. When her doctor switched her to a safer allergy medication, her brain fog lifted, and her memory started working better. These real-life cases highlight how critical it is for seniors to regularly review their medication lists with a healthcare provider. In fact, experts say seniors should bring all their prescriptions, over-the-counter drugs, vitamins, and herbal supplements to their doctor at least once a year for a medication checkup. Many seniors unknowingly combine medicines that interact or add up to dangerous levels for the brain. Now, let's take a moment to understand why some drugs are especially dangerous for seniors. As we age, our liver and kidneys work more slowly, which means medications stay in the body longer. The brain also becomes more sensitive to chemicals. What might be a safe dose for a 30-year-old can cause confusion, dizziness, or memory loss in a 70-year-old. This is why seniors must be extra cautious about the types and amounts of drugs they take. Brain health is not only about avoiding harmful medications, it's also about supporting the brain with the right nutrition and habits. For example, vitamin B12 is crucial for memory, mood, and clear thinking, yet long-term use of stomach acid drugs like omeprazole can lead to B12 deficiency. Seniors should ask their doctors to check B12 levels regularly and include foods rich in it, such as eggs, fish, dairy, and lean meats. If levels are low, a supplement may be necessary. Another protective habit is regular physical activity. Walking for 20 to 30 minutes daily improves blood flow to the brain, delivering oxygen and nutrients that help keep memory sharp. Studies show that seniors who exercise regularly are less likely to experience cognitive decline compared to those who live sedentary lives. Exercise also helps reduce pain naturally, which can reduce the need for strong pain medications like opioids. Sleep is another cornerstone of brain health. Ironically, many seniors take sleeping pills that damage memory when natural sleep hygiene could work better. Going to bed at the same time each night, avoiding caffeine late in the day, and keeping the bedroom dark and cool can improve sleep quality without harmful drugs. Hydration is equally important. Dehydration is a common but overlooked cause of confusion in seniors. Sometimes, what looks like memory loss is actually the brain struggling from lack of fluids. Seniors should aim for at least 6 to 8 glasses of water daily unless otherwise advised by a doctor. Food choices also play a vital role. A diet rich in fruits, vegetables, whole grains, nuts, and omega-3 fatty acids supports brain function and lowers inflammation. Blueberries, walnuts, salmon, and leafy greens are especially powerful for memory protection. On the other hand, processed foods, sugary drinks, and excessive alcohol can worsen brain fog and memory loss. Mental exercise is just as crucial as physical exercise. Reading, solving puzzles, learning a new skill, or even engaging in meaningful conversations stimulates brain connections and builds cognitive reserve. This helps the brain stay resilient even in the face of challenges like medication side effects. Let's not forget the role of social connection. Seniors who stay socially active, spending time with friends, volunteering, or joining community groups, are far less likely to develop dementia symptoms compared to those who live in isolation. Loneliness itself can accelerate memory decline, so staying connected is a powerful medicine for the brain. Returning to medications, one of the biggest dangers is when seniors take several prescriptions at once, a situation known as polypharmacy. It's not uncommon for seniors to be on 5, 10, or even more medications at the same time. Each may be necessary on its own, but together they can interact in harmful ways, magnifying confusion, drowsiness, and memory loss. A common scenario is a senior on a bladder drug, an allergy pill, and a sleep aid, all of which reduce acetylcholine. The combined effect can mimic severe dementia, even though the root cause is medication overload. This is why families play an important role. Loved ones should observe changes in behavior, memory, or mood and encourage seniors to speak to their doctors. Many seniors are hesitant to question their prescriptions, thinking, the doctor knows best. While that is often true, doctors may not always know the full picture unless patients share their symptoms and all the medications they're taking. Open communication saves lives and minds. There are also non-drug approaches to managing common senior problems that often lead to dangerous prescriptions. For example, instead of bladder medications, seniors can practice scheduled bathroom visits, avoid caffeine, and do Kegel exercises to strengthen pelvic muscles. Instead of opioids for pain, physical therapy, acupuncture, or gentle yoga can make a remarkable difference. Instead of sedatives for anxiety, breathing exercises, meditation, and supportive counseling can calm the mind naturally. It's also worth mentioning that some seniors are more sensitive to medications because of genetics. For instance, certain people process drugs more slowly, leading to higher levels in the bloodstream and more side effects. This is why one person may do fine on a medication, while another develops confusion and memory loss. Personalized care is the key. If you are a senior or you care for one, make it a habit to ask your doctor at every visit, is this medication still necessary? Is there a safer option? What would happen if I stopped or lowered the dose? These questions can make the difference between a foggy mind and a sharp, vibrant life. The most heartbreaking part of this topic is when seniors are misdiagnosed with dementia and placed in memory care facilities, when in fact their symptoms were drug-induced and potentially reversible. Families suffer, patients lose their independence, and the root cause is never addressed. Awareness can prevent such tragedies. So let this message be clear: protecting your brain is just as important as protecting your heart or your bones. Every pill has two sides, benefits and risks. Understanding both is your right and your responsibility. With the right knowledge, you can work with your doctor to find balance, ensuring your medications help you without stealing your memory. Your brain is the treasure chest of your life experiences, your wisdom, your laughter, and your love. Don't let it be clouded unnecessarily. Make wise choices, stay curious, nourish your body and mind, and always stay informed. Think about it, your memories are not just little thoughts in your mind. They are the story of your life. They are the laughter you shared with your children, the lessons you passed on to your grandchildren, the moments of love, strength, and struggle that made you who you are today. Losing those memories is not just about forgetting, it's about losing a piece of yourself. And yet, many seniors unknowingly put their memories at risk every single day by taking medications that quietly chip away at their brainpower. But here's the truth you need to hold on to: dementia is not always your destiny. In many cases, you have more control than you realize. By asking the right questions, by reviewing your prescriptions, by taking simple steps to protect your brain, you can guard the most precious gift you have, your mind. So I ask you today, don't stay silent. Don't wait until confusion takes over. Don't assume memory loss is just old age. Speak up. Talk to your doctor. Demand answers. You deserve to know whether the pills you take are truly helping you or quietly harming you. And remember, your brain is not just an organ, it's the seat of your soul, your wisdom, and your story. Protect it with the same passion you would protect your family, your home, or your future. To every senior listening right now, you are not powerless. You are not alone. Your choices today can shape your tomorrow. Stay informed, stay strong, and never forget that your health, your memory, and your life are worth fighting for. If this video has opened your eyes, please share it with someone you love. You might just save a memory, save a mind, or even save a life. Let's stand together, protect each other, and create a future where seniors live with clarity, dignity, and strength. Your health is your greatest wealth. Guard it well. Stay safe, stay healthy, and stay sharp.